practice really is, and has been now for many years, limited pretty much to facial rejuvenation, facelift surgery, and I still do a lot of rhinoplasty, so it's a part of our practice. I did my medical school many years ago. I've been upstate New York for a lot of years. I did my fellowship in Chicago. I was at Albany Med about trauma for years. I was the chief of facial plastic surgery, and I am a clinical professor at Albany Med. So, not that matters a lot of it really to me. People always ask me, board certification, yeah, it's important. But to me, one of the most important things I'm looking for, if I'm looking to have something very technical done, is someone who specializes and who has tons of experience. And I've been, 33 years at this. I've done thousands of facelifts alone, but over 10,000 or so procedures. I can't keep track of them at this point. About me, and this is my wife, and I'm on the left side. This is my 4 kids. My youngest, Edwin. That's our oldest daughter. So this one is, that was the wedding. It was just.
Yeah.
And that's our other daughter, Lydia, and that's my son. That's my other daughter, Lydia, and I have a vineyard, I'm a pilot, I do a lot of other things that are kind of interesting. And I love agriculture. I don't know why, it's just for me, I find it fascinating. So I still prune my own grapes. So we created a destination practice, and I'm very proud of it. It was always my vision many, many, many years ago. And being here, located here by the airport, it makes it very central for people to come visit for surgery, and also for visiting doctors. And it was always a dream of mine, but we made it happen. So our motto is, and always has been, take care of each other. And we are really focused not only on our patients but our team. I mean, Southwest used to say we take care of our people, say take care of you, but it is the case here. We take care of each other, and I really do consider us a family here. Many of us have been here for decades, and that doesn't mean we don't let people go who are not taking care of the rest of the team or our patients. But we do believe we deliver world-class care, and that's what it takes to get people to come a long distance to come see you. We do have an on-site ambulatory surgery center, and people, 20 years ago that was a new thing. People worried about safety, but it is a fully accredited ambulatory surgery center, same standards of care that we do in the hospital. And we just went through our 10th round of accreditation, so we've been accredited by the state, federal government, every 3 years and this is our 10th round of accreditation. So, what sets us apart? Again, it's just not a room here where we're doing surgery. It's a fully accredited thing. If you go downstairs, that's what it looks like. I mean, it looks like a hospital because it basically is. So, what I like about it is it's one-on-one nursing care, and it's a very private facility. So we get people that tell us that want to share their story with the world here, and I feel very comfortable about that. There's just a little video that I made. And do I just advance on this next?
Yeah, just
we still have the same standards of care, the safety that we have in the hospital. But I really didn't feel that the hospital was serving our patients in a very private setting as well as we could do if we had control of that. So we went through the AAAC accreditation agency, which is also Medicare approved and inspected by the New York State. It is a fully compliant facility that has backups for everything, backup generators, backup systems. We have 25 air changes an hour with 5 fresh air changes. I'm proud of the fact that I've never had to transfer patients to the hospital. We have transfer radios and all of those things that comply to the highest standards.
I made this video with COVID because people were worried about that.
When I'm doing the surgical procedure, I literally put out my hand and my structure has been with me for 20 years, knows what instrument I need, and that's a huge advantage. As a surgeon, it's also a huge advantage to the patient because we're getting the same team every single day.
People don't realize what a benefit that is, but if I can do a facelift in less time for a patient, it's less anesthesia. But if you have like an orchestra, and my team knows what we want, we move through things much more efficiently than. And people who are in medicine don't understand this, but I work in the hospital, I get whoever they throw me that day. And it literally sometimes takes me twice as long to do in the hospital. So this is a video I made about the fundamentals of a deep plane facelift because people don't understand it. And not most people who come here, or most patients don't really want to watch a graphic surgical video. I have a lot of those on YouTube, teaching other surgeons how to do it. But this is my way of explaining what is it, like, illustrating what exactly is a deep plane facelift. And this is on YouTube video too, right? All of this is the
represents my skin, okay? And underneath it, you heard this word SMAS. That's the submusculoaponeurotic system. And that is a layer that is contiguous with the platysma, the muscle in your neck, and up here in the temporal parietal area. But basically, this is the fascial layer that we work on. Now, on the skin surface, you see a jowl, and you see some deepening of this nasolabial fold. So when we do the surgery, the traditional surgery, you lift up the flap. You see, actually the older facelift surgery is just pull the skin. But as you can see, with this wrinkle in the underlying SMAS, just pulling the skin tight is not going to give an effective elimination. You can still see that lump in there, just like having a pillow in a bed, right? So I'm going to pull this over here. Let's assume when we're doing surgery, we are reflecting this. The most common technique used in the country is what's called an embrotication technique. And what that means is we take a little strip out of this SMAS, and then we tighten it a little bit, and then we lay that back down and lay the skin down. So I'm going to show you what that looks like and why that's different from a true deep plane lift. So I'm going to go ahead and just demonstrate this by taking a little strip of the SMAS out. I'm going to get a hold of it here. Okay, and so here I'm taking this strip out of the SMAS. We got Dr. Rose with your chuckle. It's like in church. What kind of supposed to have, right? All right. So we take out. And this is, again, probably the most common way to do a facelift in the country. Okay? And this is called an embrocation technique.
This is probably the gold standard,
you can see,
in my opinion,
that you can actually tighten this SMAS up.
for this reason.
You can tighten this SMAS up a little bit, but the problem with it is there's resistance on where the ligaments are. And when you pull the skin back, you're still going to have a little bit of a lump, okay? It's not as effective, I should say. There are people saying they're doing a deep plane lift, and what they're actually doing is they're kind of going into here and they're spreading, okay, they're spreading this tissue to try to release this a little bit. But a true deep plane facelift, and I'm going to show you this, carries this dissection further up here, okay, and cuts these little ligaments. And I'm going to show you something. When we cut these ligaments, okay, all these little ligaments here, and you cut these little ligaments over here in the face, and take this down further into the neck, which is what we do now with our deep plane lift. I want to show you something. Look what happens to the SMAS. Okay? Now we trim this all, but look what happens to the jowl, and more importantly, look what happens to that jawline. Okay? So it restores tension in this direction, but more importantly, you get all of the tension on the SMAS, repositioning things back where they should be, because this SMAS is what stretches out. We trim this. I'm not going to bother to show you all that right now in the interest of time. But then the skin really redrapes, and it's a much more youthful jawline. It softens its fold.
And that's the big difference right there.
So I hope that gives you an understanding as to what a true deep plane is.
People ask me all the time, what do you do with the ligaments? Well, I don't say that in this video, but we reattach everything. I trim the deep SMAS, put all the tension on the deep SMAS, and then what allows us to trim the skin with no tension on it. But I want you to look very critically at the before and after photos, because again, I see this from people around the country saying they're doing a deep plane. Where you really see it is in the jowl and in the jawline. And what patients tell me is, I love my face, but I love my neck. because it really doesn't. And I want you to look critically at these, because to me, the most important thing is leaving people looking extremely natural. No one would know. And I want you to be very critical of my work. All of the photos on Instagram are my patients, all the photos on my Facelift, and there's dozens and dozens and dozens of them. But people always ask, what are the costs? Our patient concierge are here, they can talk to you about that. But basically, there's usually 3 fees. There's a surgical fee, there's anesthesia for the people, we have anesthesia providers. I don't do your anesthesia because that's not my thing. And then we have the facility fee. So we can go through that later. People always want to know what that is. Okay, so consultation process. These 2 women, Nicole and Sarah, are extremely knowledgeable. They're actually here. They are so good they can almost finish my sentence most of the time. But if there's ever a question, they can come to me. But typically what people do is they call, they talk to Sarah or they talk to Nicole, and they will, what are their concerns? And they're really good at figuring out, timing and working through logistics. We have a lot of patients now traveling from out of town, and we offer a concierge service I think there's 3 hotels we work with locally on a very regular basis. But we make it easy for the patient because, we want to make it easy for them. If you think of why do people like Target? Because it's so, or not Target, Amazon, right? Because it's so easy. And so these 2 are wonderful, and they're a very integral part of the team, and they're here. So one of the things I do in the consultation is I do computerized images, and I don't have time to get into it, but basically, and anyone who's been through it knows I've done some imaging with them, and I tell them, I won't show you something I don't think I can get really close to. But it allows people to have an educated understanding of what my goal is. And like I said, I get really close to that. And that's just, that's important for making a decision. When's the right time? I get this question all the time. Typically, most of my patients are mid-40s to probably mid-70s. I've got a few in their 80s, believe it or not. Typically someone who's had one before, who says, look, I'm not ready to sit on a rocking chair and report somewhere. I've heard the story many times. People say, I still square dance, I still do this, I still line dance, all this other nonsense, right? But they're usually people who are pretty driven and motivated, and they're happy with life, and not looking to just, but when's the ideal time? I tell patients, the ideal time is when you're starting to see it and it's starting to really bug you. The average person thinks about it for about 2.5 to 3 years before they make that decision. I've had people tell me, no, I've been thinking about this for 10 years. And so people think about it. And so there is no ideal time. Only you know when is the ideal time. People say, should I have it done? I said, well, tell me, does it bother you? If it doesn't bother you, if you're doing it for someone else, it's not ideal, right? But, and I say that because that's how you end up with happy patients. At the end of the day, I want to have a patient. But if people see it, if someone's encouraging them to have it, it's not really the ideal time. So usually the lift itself takes me about 3 hours. I no longer use drains. Day 1, so you're done here in the surgery center, you go home the same day or go to the hotel, depending if people coming from out of town. People coming from out of town who are driving distance, Boston, Philadelphia or something, they'll stay here for a day or 2. And then they'll go home and they'll come back in day 8 and take the sutures out. So no drains, there's a dressing that kind of goes a wrap dressing that we take off the next day. Dressing is removed, incisions are cleaned, and then they come back at day 8 for the suture to go on. So that's pretty much it. And then I tell people, most people with just a lift can go out in public somewhere around 10 days to 2 weeks, some people a little bit longer. Most people, if they're willing to fuss with makeup and fuss with their hair a little bit, can be in the public. It's easier now for a lot of people because they work remotely. Because the biggest, we know we're prescribing narcotics, and most of our patients just tell me it feels tight. It feels tight for that first couple of weeks. It's not choking tight, but it feels tight. So people have their wits about them, and so people who want to work and get on their laptop, they can do that in a couple of days and just go turn the video on, I guess. But these are important things. I usually tell people that somewhere around 3 weeks, no restrictions. Working out in the gym and all that sort of thing. So here's someone who's 56 years old, so in different ranges, just to show what the recovery is. And this is the very next day. Did she have a chemical peel too? No.
Technically more than anything, but the results are what for it. And the recovery is nowhere near 1 day out. It's impressive.
Have you seen your necklace? Yeah.
No, not.
Okay, here we go.
Go slow.
Oh, it's great.
And I know your daughter's only concern is that she lives in the
Let me show you these things up close, so make sure you see that it's visible.
Her brochure, man.
Day 2.
Did you do the eyes?
I did her own
Yeah,
eyes, yes. I did, yeah.
So that's a
Here's
complete.
day 6, yeah. So basically, most of us from here now, these incisions, you're gonna see long-term, initially you see them.
Stop. We've had my stitches removed. Everything's coming along quite well, and I'm really excited to see the final result.
But I bevel that incision so the hair grows through it eventually. Should day 20. Day 41.
Hi, I'm 6 weeks from having a deep clean facelift. It went great.
That's terrific.
I celebrated my 56th birthday, and to the surprise of my entire family, I didn't look like I was 56.
The biggest thing, again, this is, about a month, I can still see that incision, but with time. But the biggest thing with her, to me, she does not look old or tight. No one would know. She just looks great. She's
Still to her. Yeah.
Yeah. And you'll see this. Here's another woman here. She's before. Okay. Day 1 month, 7 months. She just sent us the other day in her car. I mean, so it's good.
She's in her 60s.
Yeah, 64. So, here's someone who waited a little longer. But again, it really restores this triangularity and rejuvenates from here. This is the part of people, look at this, I mean,
Big difference. Yeah.
and that's what's really important to people, is not just the face, it's the neck. And there is no other lift, and like I said, around 2010, I literally went back to the cadaver lab about a dozen times at Albany Med and worked through all this. So now I finally feel like I've got to figure it out. Where's the incision? Initially you see it, as I showed you.
Okay, so look guys, right up in the hairline, and I bevel that incision, so the hair after the surgery actually grows right through that incision and makes it almost imperceptible. Then what I do is I come back here and go behind this thing called the tragus, so you really don't see this incision. And then as I come out behind the tragus, I come down in here, this little creep, because we want to get all of this in the neck, actually come right up on the back of the ear here, where you don't see it. Okay. And then I come across around here, and then I dot right down in the hairline. And the same thing as in the front of the ear. If we bevel this incision here, the hair grows through it, and that's how we make it basically imperceptible. So someone can also wear the hair up in a ponytail.
So here's kind of the progression of things. Here's 6 months. And you're starting to see the hair grow through that now. And eventually it grows through a poop. There is a newer approach I'm using, but it does have some limitations. I call it scarless approach, because it's actually in the hairline. The challenge I have with that is because if you're moving a lot of tissue, so not everyone's a candidate for it. But if I have to move a lot of tissue, think about this, I gotta cut it off. So some people, like this woman here, she was in her 60s. I usually reserve it for someone who's a little younger, but sometimes I can do, and I'll show you this a little more. She has no incision here, it's actually in the hairline. But it's not for most people. The other thing is they have a little bit of additional swelling in that area that takes about 4 weeks to go away, and most people just don't have the patience for that.
For someone who doesn't have a lot going on here, and we're really looking to clean the jawline up, I can take this incision out, and rather than come out here, I actually sneak it in behind the hairline. And it allows me to get all the way down into here, but without having to move out. But it is important to really pick your patients correctly, because if I have someone who has a lot of tissue that's moving here, we can't do that because I didn't move.
I really talk about this just because there's so much hype and marketing out there. I probably only do this for maybe 10% of the patients. I think most patients you need to remove the skin. But if you see this is what this refers to. I do feel it has some limitations, but there are those people that are good candidates for us, so if you do see that. Okay, so how long is the recovery period? I typically tell people, well, initially, when can you go out in public? Because that's what people really want. When can I go out in public? Somewhere in a couple of weeks. When can I return to exercise? I say no restrictions at 3 to 4 weeks. That means you can walk to your heart's content the first week or 2 or 3 weeks. So walking is fine. I just don't want you to get like a 45-minute Peloton workout. Recovery, we have eliminated narcotics. Our patients do better. We basically give them a day or two of Valium, and they say that like this is the best thing, because the problem with narcotics, your sleeping is all screwed up. That's not good for healing. You're up at night, you're sleeping during the day, it screws up your GI system, so I've eliminated it. And same thing with antibiotics. We don't routinely give everyone antibiotics unless we're worried about something in the post-op period. Same thing, antibiotics, the GI system wreaks havoc. And so our goal is to make this the absolute best and easy experience possible. We've eliminated a lot of the drugs, believe it or not. So, here's someone we know. Danielle, she was kind enough to join us today. This is Danielle, she came in. She's a little on the younger side, but she looks terrific, and and you'll hear from her a little bit later. But I remember her saying, right? I think you told me this. I wanted to enjoy it. I want to do it when I can enjoy it, and not wait. And I know this is what was bugging her, right? Starting to see this in the mirror.
And the jowls.
And the jowls. So, but and I think she looks terrific. I think she looks like herself. That's her. But again, this is the thing that people really love. All of this down in here. There's her front view. Subtle, very natural, but here's this heavy square has now been that triangularity of youth has been restored. This looks very natural to me.
Yeah.
Another patient who's late 40s, same story. I mean, this is what she said. I mean, if you take a look now, she's far enough out you can't see her incision at all. And here's her neck. Again, not drastic, but this really bothered her. She was saying thing. This person had she had a lift, and you'll hear from her in a little bit, but she also had a lip lift, and it's a very common procedure I do now. We did one this week with a facelift. We're seeing more and more people with what I call filler fatigue. They're like, and if you take a look at the lips, and I have a number of them on the website, they look very, very natural. Filler does okay in the lips, but the problem is people are overfilling, and now we have these med spots popping up all over the place. I've been doing this for 30 years. I mean, now people are working in the ER, and they took a course, and legally they can inject. So, but it's not that things can't just be done, but to do things and do things well. What I like about the lip lift, now if you take a look at her, you can see this incision initially, but with time it's imperceptible. Okay, but look at how natural Cupid's bow and the lips look. You can see, and I'll show you, actually this is her, she's 52.
Had dinner with a family member, and of course I didn't want to tell anybody, and especially family members because they can judge. And she just kept looking at me and she said, I don't know what you're doing, but you look amazing. She told me I look better than I did 10 years ago. And I was like, really? She's like, yeah, you just look so good. You look so rested and refreshed. You just look so good. And I just told her I was, using good skincare, but it was really nice to see. It was really nice. And also too, as a woman, you see people turning heads and looking and complimenting you, especially people that you know. It's nice. It gives you affirmation that I did the right thing. I did the right thing. I personally think that I understand you're nervous. I understand that this is a very big decision.
It is a big decision, and so people only know. But again, I think you're going to show some older patients and show some younger patients. But again, what I'm proud of is when I look at this woman, you would never know she had surgery until you see this. Okay? And that's what we're after. And if you think about it for a second, and I say this over and over and over, when surgery is done well, you don't see it. Unfortunately, we see fillers that are done poorly, and we see people who have not had great surgery, but here she is, I think she's about a year out in this photo, 56 years old. She was thrilled. I mean, she made a recovery video for us, but again, looks very, very natural.
Did she have her lips done?
I don't believe I did her lips, no.
Just Facelift.
We just sort of, yeah, we did not do, I'm sure there'll be some other ones in here.
Her recovery videos on our YouTube channel.
Yeah, yeah, I mean, if you, well, she sent us a, you know, I've been doing this long enough now, it's not cool, people come in and say, hey, I'll make a video for you on my whole recovery. And she goes all the way out like 3 months, right?
She went out to a Christmas party like 4 weeks out.
So it's nice because people, you know, you do still have some residual swelling and healing for a few months, right? I mean, and yeah, you know, you feel comfortable going out. So I tell people it takes a full, you know, many months to get to that absolute best result, probably 2 or 3 months anyway.
But on this woman right here, the before picture.
Yeah.
See the white over her lips?
Yes.
Is that like retinol or something? What
No,
is it?
I'm not sure what this is, but you can see this when someone's had like dermabrasion or chemical peel, or,
Oh.
you know, if they've had something aggressively different. I'm not even sure
I
what.
think it might just be the lighting of the camera on
I'm
her
not being-
mouth area.
Not really sure. But again, when I look at her, I feel really good about this. Okay, this is the big difference, okay? I want you to, when people say they're doing the deep plane, because I dare say that 70, 80% of people will say, or maybe more, who say they're doing this lift are not doing it and doing it well. But look at this area here. You see how this has all been moved back? Now what we're seeing is people putting too much filler in here to try to lift this. It doesn't work that way. When this tissue stretches out, the only way to get it to rejuvenate is to get it backward. And then, you know, this, and then this whole thing, and then all the way down to here. This, like I said, people love that, the fact that we get that, and that all the way down, well, here she is. I think she looks 10 years younger. I did her upper eyes. I'm gonna talk about, you know, someone with a heavier neck too, because sometimes I have to do what's called a deep neck lift, and I'll show a couple of ways. Some people just have a big heavy neck, and this woman, and she was done fairly recently, but you know, this is a tough neck. So I actually go deep and below the muscle, clean out fatty tissue there, and put it all back and use that to tighten up. But here she is. You know, I think she's got a, she actually gave me a Williams in her ties. In fact, so, yeah. And to me, one of the biggest honors is that, you know, I'm actually getting plastic surgery. Surgeons sending patients, especially family members, which is pretty cool. But she was sent, I think, a plastic surgeon sent me. Here's another one, 59 years of age. I did do her lower eyes too. I did her upper eyes. And I just want to point something out, okay? I am so sensitive to people having dry eyes. I would rather leave a little something here, but it looks natural. But it's a big improvement of her eyes. You see that? And so I think, you know, what I always do is I manage expectations by telling people, you know, don't expect a 20-year-old set of eyes. I'm going to do as much as I can safely, which is really important. You saw this one from the beginning. She was 64. Here she is in the early, but again, very natural look. She did a little video
My name
for
is
us.
Helen, and I am 64 years old. After my surgery, I had to attend an event, I will say, where there were many, many people that I ran into
This was
there from my previous job. I was a teacher, so many of my students and my colleagues were at this event. Received many, many compliments, but the best compliment I got was I ran into Dr. Williams, who came right up to me and said, "You look fantastic!" And I said to him, and I'm telling everybody here that I'm speaking to who talks to me, I let them know who my surgeon was. So that really was a boost.
She was a sweetheart. She actually.
And a lot of people will say to me,
She was really
you can't even tell anything if it was done to just look
unbelievable.
more relaxed or.
Here's someone, you know, 65 years old, you know, again, not a 20-year-old, neck and jawline, but look at the difference here. It's huge. You know, cleaning all that back up, not over tightened.
So, are you able to address the lips, the
Yes,
lines?
it depends. It depends. Like, you know, I am not sure. So the most difficult line to get rid of is that horizontal.
Yeah.
But many of our patients, if you look on my website, I will describe in the description exactly what they had, who had their eyes done, and a lot of our patients will have a chemical peel, or something like that. A lot of them do. This was, I had actually a husband and wife team, signed up this week, and I get a lot of girlfriends that come in, have it done together, I have mother's daughters, that was interesting once, I had a mother's daughter. More husband wives than so we had a husband and wife in this week who scheduled, and they wanted to do the same thing. I said, I don't know if that's a good idea. They were planning they would come here, we'll kind of go in the hotel, but, again, someone's a little older, she had a heavier neck. Another, woman with a heavy neck. I've known her for a long time. She's actually my cousin. but Freddie, I joke, she's from Latham, Vermont, and I've known her forever. She's worked for Sotheby's, but she has been threatening to have a facelift forever, And she finally was, her son's getting married in October. So, and I actually just ran into her, she was in my door. But yeah, it's funny. People always say, eventually, if no one ends up operating on your friends and family, you won't have a practice, right? but I've known Freddie since I was since I was a kid. But my favorite memory of her was when I went skiing in Killington. I was about 16. The drinking age was 18 back then. Freddie was 3 years older than me, so she was like, so she took me to the top, and we sat up there and drank beer, and I was 16 years old. You could do that back then. And we ski down. Anyway, but this is Freddie. I mean, and this is an early result. You can see her month. You can still see these decisions. Hair's just starting to go through that. But she looks terrific. Right here she is.
Thank you for a follow-up. And I'm just going to explain a little bit about my journey. I came in and had my deepening facelift right here in the Williams Center. And then I went to a hotel nearby. And I had a nurse from here stay with me that night, and it was a very comfortable night, and Meg, the nurse, was incredible. She was an angel by my side that night, not that I really needed one, but it was a real comfort to me. I just would like to say that I feel like the Williams Center, the people here, the nurses here, the doctors here, Dr. Williams, they're just incredible at what they do. And Dr. Williams, people just have a lot of trust with him, and I think it's really important to have trust when you do something like this. It's a big deal.
I was thinking about this, when I used to go skiing with her back in the day, I never thought I'd be with a facelift. Think about that. Okay, so this woman's a little older. She's probably late 60s. She just sent us.
Oh my God.
We call these lifestyles. And people are lifestyle photos. What happens is people get so upset, they see pictures of themselves, and then they send it to you. Like, oh my God, I just saw this picture of myself. But yeah, but I had to do a deep background with her. She had a lot going on in her neck. But again, I think she looks extremely natural. Here's a woman that'll talk about wrinkling, right? So I did a lift on her. But I also did a CO2 laser for her face for wrinkling. The CO2 laser is the most aggressive way to treat deep wrinkling. Not for everybody. I help most people out of it because it's a significant recovery. People look like they had a really bad sunburn for almost 2-3 weeks, but it can actually go out to close to a couple of months. But look at the difference in the wrinkles.
Is that the one you see on the internet where they're zapping the skin and it looks like it's shrinking up?
Well, yes, no, there's the CO2, ablative CO2, and then there's fractional CO2. So again, it depends on what they're promoting.
And I think that's something too.
So the CO2 laser, I'm really pick and choose because if you follow these patients long enough, I won't do a CO2 laser on someone unless they get fair skin. And I've been doing full face CO2 laser since 1995, so it's a lot of years. But these patients will get some hypopigmentation. Notice how she's a little lighter, okay? And these patients have to be very careful on the sun. And that's another reason why I do a lot more chemical peels, because the thing with CO2 is you have to have that conversation with people. Now, you ask her whether it was worth it, okay? And she's going to say yes, because the people that I do it on are the ones that we have that conversation. But the results are pretty dramatic. You can get probably about half that result with a nice deep chemical peel without the hypopigmentation that you get with the CO2 laser. But
How long would that last, the deep chemical peel?
So the changes in the skin are permanent. We're just kind of moving people back in the conveyor belt. So you're going to continue to age. In other words, the architectural changes, the collagen deposition, the wrinkle reduction is a permanent thing. It's just not as effective as this. So it's a permanent thing. It's just that you'll continue to age. And like I said, for people who are curious, I don't know if I have any way to chemical peel in this talk, but I have a number of them on my website. Look closely in the description. A lot of our people have what we call a customized TCA chemical peel, meaning I do like a little deeper around here, and I do lighter in other areas. And in other words, I do deeper where the areas of wrinkling are, around here, around the
Sorry, I was gonna, if you did a facelift, this deep facelift, and a chemical peel, you do one first?
I do it at the same time. But technically, in the OR, I do peel first. But I usually do the peel first, and then I do the lift. So here's a woman who's a little old. I did her lower eyes and her upper eyes.
Amazing.
And she was from
Louisiana.
Louisiana. So she came from Louisiana, stayed here, for the period of time, and we do FaceTime follow-up with her. But she's 74 years old. She looks terrific, right? Male patients. There are some gens that have. It's interesting. I have men that have facelifts, but I don't have a lot of them that give permission because it's not women. It's like a badge of honor.
That's okay, I have to hire her or something.
Another woman, she was down Southern Columbia County. But again, 75 years old. Was very worried about looking natural. And again, I think if you come over here, I think she looks very natural.
Did you do the eyes?
I did her upper eyes, but I did not do her lowers. It's interesting. So, someone who's naive or people I train with, they might come and say, well, why didn't you do her lower eyes? So why do you think I didn't do her lower eyes?
She wants to look natural.
It didn't bother her. Who am I to say you should do eyes? So I always start consult, and I say, what's bugging you? Now, some people will say, well, what do you think I should do? And I'll say, well, I use a step ladder analogy. I say, look, if you were to take one step up, this is what I would do. If you were to take two steps up, but I just don't believe in pushing people because they know what bothers them. They know and so that's also how you end up with happy patients. She looks terrific, though. Her age. We have somebody who's not here. This is Donna. She's kind enough to come back and share a little bit of her. And look terrific, right?
Wow.
Here's another. This woman came from.
I'm 58 years old. I thought I was for 4 years, and there's been research for over 2.5 years. And I was ambivalent about doing it because I just wanted to know everything before I made the decision. She had over, I think, 8 or 9 individual consults with different plastic surgeons.
She went all over.
All from New York City to Boston. And my last consult was with Dr. Williams. And even throughout those other consults, I wasn't even sure if I wanted to go forward with the procedure. But once I came here and I met him and his staff, I was left confident that
She could look great with it here. She did not want to look surgery. Real concern. So I'm going to stop there. I'm happy to take questions. My team is here. I know Don and Daniel were kind enough, really very thank both for coming, taking time out of your crazy schedules to come visit me. And so we had a couple of different people who were here to help share their story.
Donna.
Hi, I'm almost 79 years old.
Oh my God.
Wow.
You don't look it.
I have a horrible neck and I have the jowls and stuff. And it's almost 2 years since I got and at times I just go like this. Oh my God, it's still so fast. So my jawline is still great and
So there was some numbness, right, for a while. People
yes, oh yeah,
right?
but it all goes away. Dr. Williams and all the staff, they're all so wonderful to you and so helpful was I gonna say, oh, and my concern was like, oh, geez, you better, we don't give any pain medicine, you don't need, I'm like, whoa, I've had surgery before, I said, I need something. I know, I've had surgeries, so they gave me, I think, 8 days worth of pain medicine, and that first night, I said, oh, geez, it's gonna be nighttime, maybe I better take it. And I took it, and the next night I said, well, I don't know, maybe I didn't, he said Tylenol, I'm like, I didn't even need Tylenol.
Yeah.
So it's hard to believe that you could go through, but I have the deep flame. To all my wonderful, horrible things, and it made me look beautiful. And I had my blepharoplasty, I had the eyelids done.
Oh, you did?
And actually, 2 weeks after I had mine done, I went to his class reunion. And no one ever said anything.
Yeah,
I wore my big glasses and stuff, and just in case, but it's really a beautiful thing to help yourself, to make you feel good. I still feel really good, and I've had people, like they said in these videos, that said, wow, what are you doing to yourself? You really look great. So a few people, and I feel, that's the way I felt. I didn't feel like stretched or, I just felt natural.
When you look at
Soulless.
I wish I had done it sooner, actually.
My girlfriend and I came in together, and I had it done, and I think it was about maybe a month or 2 later, she had hers done.
Oh, okay.
She is still thrilled. So it's a wonderful group here. I'm very happy, so I hope you do something for yourselves, because it's a really good feeling.
Did you change how you sleep at night? Like, do you sleep on your back to keep from getting
I've always pretty much slept on my back, but I have to say, I kind of sleep a little bit more on my side now.
Yeah.
But I've always been a back sleeper, so I can.
Really guide you and support you throughout the journey from the beginning to end. So Dr. Williams will say, they're my quarterback. So it's a huge decision, and it's helpful. It's nice to have, it's comforting to have somebody like be there with you throughout the process to help you along the way. So that's what we're here for, and it's nice to see somebody from the beginning to the end. The confidence, like towards the end, and just the happiness. So that's what we're here for.
And I'm Sarah. I'm sorry. Been here for about 8 years. I was actually one of the nurses in the practice before taking this role. But like Nicole said, we're here to walk you along the process so that you're comfortable. There's no guessing. Anything that we don't know ourselves will go directly to Dr. Williams. So we just want you comfortable and to know the whole process.